In this presentation, we will talk about the speech and language impairment. We'll go over the definition, the etiology, diagnosis, prevalence, teaching methods, impacts, and more. Speech language are most commonly found with children. In fact, they affect about 1 in 12 children or 5% to 8% of preschool children. Speech language impairments have a wide range of conditions that at the core have challenges in effective communication. These include speech disorders that refer to impairment in the articulation of speech sounds, fluency, and voice, as well as language disorders, which refer to impairments in the use of the spoken system and involve the form, content, and the function of language. The etiology. The etiology of speech language impairments for most cases is unknown, but a variety of different causes are suspected. These include anatomical abnormalities, cognitive deficits, faulty learning, genetic differences, hearing impairments, neurologic impairments, or physiologic abnormalities. Another critical avenue for exploration into possible contributors to speech language deficits is psychosocial risk. Parents who are depressed and or have housing or food instability have children more likely to have language problems, perhaps because parents lack the energy and freedom from preoccupations to engage in the kinds of language mediated social interactions known to support optimal child language development. Detecting and intervening when psychosocial risk factors, including abuse and neglect, are present has the potential to prevent language problems from developing. Screens for psychosocial risk factors, including depression and parent-child interactions, are widely available and include the family psychosocial screen and the Brigance parent-child interactions scale. Many other screens, such as the ages and stages questionnaire, including a background information questionnaire that captures common psychosocial risk factors. For family with psychosocial risk factors, developmental promotion is essential, as is careful monitoring of progress. If brief advice and information handouts are not effective, and particularly if children have delays not sufficiently great as to qualify for services, then parent training, quality daycare, Head Start, after school tutoring, and private speech language therapy should be recommended. Language disorders are broken into three types. Receptive. People with receptive language disorder have problems understanding and processing what others say to them, despite having no hearing problems. Expressive. Expressive language disorder causes problems with using words to express thoughts, although the person has no physical problems in pronouncing the words themselves. Mixed receptive expressive. Those with this form of language disorder have trouble with both expressing their thoughts in words and understanding what others say to them. Diagnosis. Common conditions in infants, toddlers, and preschoolers are associated with receptive and expressive communication challenges. Distinguishing speech and language impairment from language delay and language difference. Language delay is characterized by the emergence of language, which is relatively late, albeit typical in its patterns of development. In contrast to an impairment, language difference is usually associated with variation in vocabulary, grammar, or sound structures. Assessment of a young child with speech language impairments. Obtaining information from multiple sources across settings is necessary to specify communication strength and challenges. Speech language pathologists make diagnosis of a specific speech language impairment, identify probable Causes determine severity, describe the likely prognosis, and provide recommendations. During assessment, speech, language, hearing, and processing abilities should be probed. Objective criteria are more important than clinical judgment to ensure consistency in the assessment of severity. To determine the prognosis for a young child with a speech language impairment, trial therapy during an assessment period is an appropriate strategy to inform prognosis. Clinicians often probe a child's response to intervention strategies to determine responsiveness to treatment and to inform the development of the treatment plan. The complexity of impairments in speech and language requires a variety of intervention approaches that can address deficits in language from syntax, phonology, morphology, language content semantics, and language use pragmatics, as well as speech and voice production. Intervention for young children may involve not just the speech language pathologist, but also care providers and peers. The main goal of intervention is to increase a child's success using language in order to communicate his or her intent, response to the intent of others, and include themselves in reciprocal interactions. Speech and language targets vary for each child, which depends on the context and aspects of communication affected. More functional approaches are sometimes appropriate, supporting communication at the point of frustration and breakdown. Intervention targets should also consider the family's wanted outcomes for their child's communication. Targets should be meaningful to the child. Teaching methods. Modeling is a typical intervention strategy that provides focused stimulation on the speech or language targets selected for an individual child. Cueing is another frequently used technique that includes direct and indirect verbal cues. Example, asking a child to imitate a sound, word, or utterance. Or nonverbal cues, for example, giving a child a jar with a desired item that can't be opened without help. Responding to a child's communication efforts through reinforcement or corrective feedback. For example, remember to say the ending sound t so we know you mean the word boat. Is frequently used to facilitate effective communication. Impact. Children with communication disorders frequently perform poorly in school, struggle with reading, have difficulty expressing their language, are unable to understand social cues, miss social cues, avoid attending school, behave poorly, and fail tests. Speech and language disorders can make it difficult for students to communicate with their peers and teachers. This can lead to frustration and isolation for the student. Strength of students with speech and language disorders. They are often very good at problem solving and are quick thinkers. They are often very expressive and can be very creative. Students with speech and language disorders often have a good memory and are good at multitasking. Thank you for watching my presentation. I hope it helped you gain more information about the speech and language impairment. Thank you.